Today we're going to go over 3 different forms of hypertension or high blood pressure. We'll begin with the first level, which is called essential hypertension. Essential hypertension is the most common form of hypertension. The cause of this type of hypertension is unknown. Most patients are also unaware that they have hypertension when they have this level, the essential form of hypertension. They don't even know that they're suffering from it. Usually it is only diagnosed in patients who have had 3 separate blood pressure readings of 140 over 90 or higher, and it's clear that those high ratings are not due to some other medical condition or disease. So normal reading, there's no other disease or medical reason. They have 3 separate occasions of a blood pressure reading of 140 over 90 or higher. They have essential hypertension. Most people are unaware of it until it has been diagnosed in this manner. Secondary hypertension is the next level. Secondary hypertension only affects about 5% of those who have hypertension. Once they've been diagnosed with it, it's usually due, the secondary form of hypertension is usually due to some other medical condition, such as renal disease, renal artery stenosis, aldosteronism, and pheochromocytoma. These are the sorts of things that would lead to secondary hypertension. Finally, the third level is malignant. Malignant hypertension is uncontrolled, severe hypertension and is life-threatening. It can be due to secondary causes, renal artery stenosis, or there may be no known cause. But the blood pressure levels are so high that they have to be brought down safely but rapidly. So the goal with malignant hypertension is to provide immediate treatment by decreasing the blood pressure over several hours. So no more than 25% of lowered blood pressure over a 1 to 2 hour period. This is usually done with medication, such things as nitroprussides, nitroglycerin, clonidine. Things like this are the most common medications used to treat malignant hypertension. So remember the 3 ones that we looked at today. Essential hypertension, this is the one that most people have. They don't even usually know that they have it, but on 3 separate occasions they have a blood pressure reading of 140 over 90 or higher that is not clearly due to another medical condition or disease. Finally, secondary hypertension, 5% of people have that, and it's usually due to another disease, renal artery stenosis, things like this. And then last is malignant hypertension, which is a life-threatening condition that needs to have immediate treatment by various medications where the blood pressure is brought down slowly, no more than 25% over a 1 to 2 hour period. If you'd like to know more about hypertension and related issues, please click on the link beneath this video. It'll take you to a website that'll have more information and an ebook that's available for immediate download.